Bleeding time is prolonged in all of the following conditions except option A thrombocytopenia, option B von Willebrand disease, option C vitamin K deficiency, option D aspirin administration, and the answer is option C vitamin K deficiency. ESR is influenced by the following factors. Option A concentration of plasma fibrinogen, option B shape of the RBC, option C inclination of the tube, option D all of the above, and the answer is option D all of the above. Following anticoagulants remove calcium except option A EDTA, option B oxalates, option C heparin, option D trisodium citrate, and the answer is option C heparin. The following stain is helpful in distinguishing AML from ALL except option A PAS staining, option B esterase staining, option C MPO staining, option D Sudan black B staining, and the answer is option B esterase staining. Myeloblasts are commonly observed in which of the following leukemia? Option A CML, option B erythroid leukemia, option C both, option D neither, and the answer is option C both. LAP stain is useful in the differential diagnosis of option A AML and ALL, option B CML and leukemioid reactions, option C anemia and leukemia, option D iron deficiency anemia and thalassemia, and the answer is option B CML and leukemioid reactions. Which of the following test is not helpful in diagnosing a suspected case of DIC? Option A PT, option B platelet aggregation studies, option C platelet count, option D PTT, and the answer is option B platelet aggregation studies. Direct Coombs test is performed to detect option A antibody in serum sample, option B sensitized red cells, option C complement deficiency, option D Rh antibodies, and the answer is option B sensitized red cells. First line coagulation screening tests include all the following tests except option A platelet aggregation studies, option B PT, option C PTT, option D whole blood coagulation time, and the answer is option A platelet aggregation studies. Abnormality in HBS can be denoted as option A beta 6 glucose lysine, option B beta 6 glucose valine, option C beta 30 serine, option D beta 6 3 histamine arginine, and the answer is option B beta 6 glucose valine. Brilliant crescile blue stain is used for the demonstration of option A target cells, option B Howell-Jolly bodies, option C reticulocyte, option D sickle cells, and the answer is option C reticulocyte. Percentage of HbA2 in adult individual is option A 10% to 20%, option B 96 to 98%, option C 1.5 to 3%, option D 0.5 to 1%, and the answer is option C 1.5 to 3%. RBC diluting fluids contains the following ingredients except option A sodium chloride, option B sodium citrate, option C formalin, option D acetic acid, and the answer is option D acetic acid. Wintrop's tube can be used for the following except option A hemoglobin, option B ESR, option C PCV, option D to obtain Buffy coat, and the answer is option A hemoglobin. Eosinophils are increased in the following conditions except option A asthma, option B bacterial infections, option C parasitic infestations, option D inflammatory skin disorders, and the answer is option B bacterial infections. Basophilia is very common in option A allergy, option B CML, option C typhoid, option D bacterial infections, and the answer is option B CML. Myelopoiesis include the following cells except option A normoblast, option B myeloblast, option C promyelocyte, option D metamyelocyte, and the answer is option A normoblast. Normal value of mean cell hemoglobin is option A 20 to 25, option B 27 to 32, option C 30 to 35, Option D 12 to 15. And the answer is option B 27 to 32. Basic component of Leishman stain is option A crystal violet, option B methylene blue, option C eosin, option D neutral red. And the answer is option B methylene blue. Pernicious anemia is due to option A decreased vitamin B12 in diet, option B decreased iron absorption from intestine, option C decreased vitamin B12 absorption due to the lack of intrinsic factor, option D lack of iron in diet. And the answer is option C decreased vitamin B12 absorption due to the lack of intrinsic factor. Pernicious anemia can be differentiated from other megaloblastic anemia by option A serum vitamin B12 assay, option B serum folate assay, option C Schilling's test, option D peripheral blood smear examination. And the answer is option C Schilling's test.